Hello, this is Sudharshan, and in this episode PH 1.19 part 3, we will talk about anti-epileptic drugs which are used to treat epilepsy. So what is epilepsy first of all? It is a sudden, excessive and rapid discharge of brain cells. Coming to classification of anti-epileptic drugs, we have Phenytoins, barbiturates, Iminostilbenes, carboxylic acid derivatives, Succinimide, benzodiazepines and other drugs. So Phenytoins we have phenytoin and fosphenytoin, barbiturates we have phenobarbital, Iminostilbenes we have carbamazepine, carboxylic acid derivatives like sodium valproate, then Succinimide such as ethosuximide, then benzodiazepines which are commonly lorazepam, diazepam, etc. and other or newer anti-epileptics which are Lamotrigine, topiramate, gabapentin, pregabalin, tiagabin, vigabatrin and levetiracetam. So let us see with the Phenytoins first. We have phenytoin. Yes, so coming to the mechanism of action of phenytoin, and this will be same for all the other anti-epileptic drugs. So mainly the anti-epileptic drugs will block sodium channels. So by blocking sodium channels, there is decreased neuronal firing in the form of action potentials, and so the discharge from the brain cells, the spread of the discharge will be reduced, and that reduces the seizure threshold, and also it will increase the chloride levels with GABA activation. So the chloride levels will cause hyperpolarization, which will also lead to anti-epileptic effect. And coming to especially uses of phenytoin, it can treat mainly tonic-clonic seizures, and then trigeminal neuralgias and also status epilepticus. And with the side effects, we can have gingival hyperplasia, hypersensitivity reactions, hirsutism, then megaloblastic anemia, osteomalacia, and a very important side effect of phenytoin, that is fetal Phenytoin syndrome. And also it can cause GI distress and increased heart excitation in the form of arrhythmias, and also CNS depression. That is, it can cause dizziness, vertigo, tremors, ataxia, etc. And also when administered IV, it can cause irritation of the veins and cause hypotension. And in the pharmacokinetics, we have one important prodrug, that is fosphenytoin, that is, as I said now, the prodrug of phenytoin, and this is very commonly given. So one very important rule to remember is that phenytoin cannot be administered with 5% dextrose. Only fosphenytoin can be given, because the precipitation chances are less and the chances of causing thrombophlebitis or venous irritation is less. Next we have Iminostilbene, that is carbamazepine. Yes, and if we see with carbamazepine, we have the side effects of GI distress, hypersensitivity. Then apart from that, it can cause blood dyscrasias, that is pancytopenia, and CNS depression in the form of dizziness, vertigo, ataxia, and also it is teratogenic as well. And also sometimes, rarely, it can lead to SIADH, and in the hypersensitivity reaction, it can cause Stevens-Johnson syndrome. It can also treat trigeminal neuralgia, and also it is the first line, carbamazepine, for the treatment of status epilepticus. And next we have valproic acid. Next we have the Succinimide, that is ethosuximide. So this is the one that is going to block T-type calcium channels. This is different from digoxin that inhibit L-type calcium channels. This is T-type. That is T-type thalamic calcium channels. It will inhibit. And side effects same. GI distress, hypersensitivity in the form of Stevens-Johnson syndrome and pancytopenia. And then apart from that we have carboxylic acids, that is sodium valproate. Mainly this also, just like ethosuximide, it will block T-type calcium channels. And with the side effects, it is in the mnemonic valproate itself. So we have V for vomiting, A for anorexia, then L is for hepatotoxicity or liver toxicity, P will be pancreatitis or pancytopenia, R will be rash, O for edema, then another A, that is alopecia, or I can say increased appetite, then T is for teratogenicity, and then the last one, or teratogenicity along with tremors, and E is for elevation of liver enzymes. Yes. And next we have some newer antiepileptics like Lamotrigine, and then we have topiramate. So with topiramate, the side effects, we have kidney stones, weight loss and sedation. The mechanism of action and uses are same for all the antiepileptics. So only the important key points we will be telling. Then gabapentin. So GABA, in that itself name, it will release that. And also it can treat herpes infection to an extent, trigeminal neuralgia also. As a side effect, it causes headache, fatigue and ataxia. And then pregabalin, trade name is Lyrica, and that will also act by releasing GABA from the name itself. And this causes side effects like dizziness, rhabdomyolysis, angioedema, fibromyalgia. Then tiagabin and vigabatrin. This is special, it can treat infantile spasms. And very important, it has to be used with caution because it can lead to permanent blindness. And then levetiracetam, trade name is Keppra. It is a SV2A receptor antagonist. It blocks that receptor, SV2A. It is contraindicated in chronic kidney disease. It can also treat myoclonic and tonic-clonic seizures. And side effect of psychiatric symptoms, lethargy, headache. And this will also block the calcium channels, the T-type calcium channels. And now briefly the drug interactions. First with phenytoin, it will interact with other antiepileptics like carbamazepine, then oral anticoagulants, oral contraceptives, then with methylxanthines, etc. And then with carbamazepine, as I already told, again with other antiepileptics like phenytoin, oral contraceptive pills, then with antitubercular drugs like isoniazid, with macrolides like erythromycin. And then with phenobarbital, same as that of the phenytoin. And then ethosuximide, this will interact also with other antiepileptics, but here valproic acid or sodium valproate. And drug interactions of sodium valproate, again with other antiepileptics like phenytoin, just like what carbamazepine will do. And this will also interact with carbamazepine. And also with phenobarbital, which is a sedative and hypnotic. So that is all with anti-epileptics. So thank you so much. We will see in the next lesson.